Are public health degrees still worth it? Short answer, yes. Let's talk about it. Public health degrees are not dead because the public health skill sets are still valued. Even as the public health field faces major challenges, public health degrees will remain valuable. The skill sets gained through a public health education continue to be in demand across industries and continue to provide essential opportunities for impact, growth, and career advancement. While the public health landscape is shifting, professionals in the field still have strong career prospects and can still make a critical difference in areas that are important to you. The public health degree is now going to have to be leveraged in different ways. A degree alone won't guarantee success, but there's potential to take advantage of emerging opportunities. A brief history of public health degrees. Public health education has evolved significantly over the past century to meet shifting public health needs. The first graduate education programs in public health began in the early 1900s. Formal accreditation of Master of Public Health programs began in the 1940s. From 1945 to 1973, the American Public Health Association oversaw accreditation of public health schools. In 1974, the Council on Education for Public Health, or CEEF, was established to standardize and evaluate public health education. The number of CEEF accredited public health programs has grown from just 10 in 1936 to 259 today, showing a massive expansion in formal public health education. Over time, public health degrees have diversified, offering students specializations in epidemiology, health policy, environmental health, global health, health equity, to name a few. As the field has evolved, its relevance remains strong. Why public health degrees still matter? If federal jobs are decreasing, does that mean that your public health degrees are less valuable? No, not at all. The reality is that the demand for public health skills is shifting towards other sectors, including private industry, technology, philanthropy, and health entrepreneurship. The skills you gain through public health education can allow you to make impact in many sectors. Consider the foundational skill sets that you gain in public. Consider the foundational skill sets you gain through a public health education. Public health degrees give you a toolkit that apply across sectors, from governmental and nonprofits to tech, healthcare, and consulting. These core skills include policy advocacy, which is about learning how to influence and shape policies that affect entire populations, health promotion, which is around designing and implementing programs that change behaviors and improve health outcomes, epidemiology and data analysis, understanding how to collect, interpret, and use data to make evidence-based decisions, leadership and project management, leading teams, managing programs and projects, and communicating across disciplines, systems thinking, seeing the bigger picture and how various sectors, environments, and policies intersect to influence health. These are not just health skills, these are problem solving, leadership, and strategy skills that can be applied in any field focused on people and systems. When you're thinking about CEEF competencies, public health degrees accredited by the Council on Education of Public Health, or CEEF, ensures students are trained in 22 core competencies that fall within 8 key domains. 1. Evidence-based approaches to public health. 2. Public health and healthcare systems. 3. Planning and management to promote health. 4. Policy in public health. 5. Leadership. 6. Communication. 7. Interprofessional or intersectoral practice. And 8. Systems thinking. These competencies are designed to prepare graduates not just for a job, but for leadership and innovation in public health and beyond. In a world where health challenges are increasingly complex and interdisciplinary, the competencies taught through Masters of Public Health programs and Bachelors of Public Health programs provide a foundation for making real, scalable impact, no matter where you take your career. And let's consider diverse career paths. Given the shifting public health landscape, especially with decreasing federal job opportunities, graduates must explore emerging sectors that value public health expertise and skill sets. Here's a breakdown of 7 promising career paths in public health, along with key insights into why they are growing and what roles to explore. Top 7 career paths to research as a public health landscape shifts. 1. Health technology. Example like digital health startups, AI in healthcare, health informatics. 2. Health philanthropy. Examples like foundations funding public health initiatives. 3. Pharmaceuticals and biotechnology companies, thinking about drug safety and health policy analysis. 4. Health insurance and managed care, so thinking about population health and value-based care strategies. 5. Corporate wellness and employee health, examples like workplace health programs and employee health initiatives. 6. Public health consulting and entrepreneurship, examples like advisory roles for companies or independent public health initiative consulting. And 7. Venture capital and health investments, and examples like funding public health innovations and impact investing. Public health graduates must expand their career visions. Opportunities exist beyond traditional government rules. The specific career path you envision may be disappearing. Regardless, there are many long-term careers that will benefit from your public health expertise and skill set. The shift in public health career landscapes. Where do public health graduates end up? Each year, around 18,000 students graduate with a bachelor's in public health and 18,000 with a master's. However, only 10% of bachelor's and 19% of master's graduates enter traditional government public health careers. Instead, 38% of bachelor's graduates work in for-profit organizations, while 29% of master's graduates work in healthcare organizations. Only 14% of governmental public health workforce has formal public health training. These numbers show that public health professionals are finding work beyond traditional government rules, and that is not necessarily a bad thing. When you're thinking about traditional careers versus emerging opportunities, traditionally, the traditional career in public health are more up in the air right now, more so than ever. Traditional roles in public health include working at health departments, CDC, NIH, FDA, USAID, research institutions, and hospitals. While federal agencies are being shaken up, job prospects don't seem to be the brightest. Many internships and fellowship programs at these agencies have also been paused or eliminated. The current federal administration seems set on decreasing the size of the federal workforce. It is yet to be seen how traditional public health careers will play out. But if you're a student, I'd suggest prioritizing other non-traditional career paths for this time being. Thinking about emerging opportunities, while traditional roles are turbulent, there are many emerging opportunities to leverage your public health skill sets. These opportunities always existed, but now are more sought after than previously. During the pandemic, there was a new light shone on the value of a public health skill set. Non-traditional industries saw that value that various parts of public health skill sets can offer. So when you're thinking about the landscape of federal public health careers versus public health professionals, let me lay it out for you. With mass federal layoffs, there is now a mass influx of professionals entering into an already turbulent job market. This means for early career professionals, job prospects are hard, but not impossible. Things are bad for traditional public health roles. Funding cuts, political interference, and mass layoffs have created uncertainty in governmental public health jobs. There have been so many federally funded research grants that have been halted or terminated as well. Many internships and fellowship programs have been dismantled, making it harder for students to enter into traditional public health pathways. Things aren't as bad for public health professionals, though. Public health skills remain in high demand, especially in data science and analytics, health policy and philanthropy, and community health initiatives. The pandemic emphasized the need for strong public health leadership and expanded non-traditional roles in corporate, nonprofit, and tech sectors. When you'll feel the value of your public health degree. A public health degree is valuable when you strategically apply it to emerging opportunities. Think about these 3 things. 1. If you want to work at the intersection of health, community impact, and data-driven decision-making, a public health degree is a strong asset. 2. If you're interested in preventive health, health equity, systems change, your degree opens many doors. And 3. If you're willing to leverage your degree beyond traditional public health rules, you will find even greater career opportunities. The key takeaway here is, a public health degree alone won't guarantee career success, but strategic positioning, networking, and adaptability will. Here's some serious considerations for pursuing a public health degree. I'll be sharing more detailed thoughts on this soon. but I want you to consider these three things before jumping into a public health degree. Number one, the cost versus the return on investment. Before enrolling and committing to a public health degree, consider tuition costs and funding. So things like scholarships, assistantships, in-state tuition, etc. The job market and career prospects in your intended focus area. The university's connections and alumni networks that can open doors for you. Long-term earning potential, not just your first job out of your university experience. So to give you an example, let's say an MPH program costs $50,000. If your starting salary after graduation is $55,000, the return might seem small at first glance. But if you receive scholarships or assistantships, the cost can drop significantly, making the degree much more financially feasible. Plus, if you're transitioning from a lower paying role, example, a job that paid you $35,000 in a community-based job, to a more specialized public health position starting at $65,000, the long-term payoff can be well worth it. An MPH also makes sense if the program offers strong practicum opportunities, access to influential alumni, or connections to health departments or specific organizations or industries. Even if the initial salary isn't huge, the degree can open doors to leadership, policy, or global health roles down the line. The key is to do your research, estimate your total investment, and make sure the career path you're pursuing aligns both with your financial goals and your passion for impact in public health. So a quick tip here is to do the math. Use a loan repayment calculator and research the salary ranges on sites like Glassdoor, PayScale, or the CEF outcomes reports. Then ask yourself, will this investment help me grow, open new doors, and feel aligned with my values, not just financially, but holistically? 2. Your passion for public health. Public health is rooted in purpose, advancing health equity, preventing disease, and creating systemic change. If you're drawn to this field, passion matters, but it must be paired with strategy. Too often, public health professionals are told to sacrifice financial stability for impact. But passion should not mean settling for low pay or burnout. Ask yourself, does this work align with the change I want to create? Will I be supported and paid fairly in the process? Passion is your fuel, but strategy is your map. With both, you can build a meaningful, sustainable career in public health. And then 3, alternative paths. Not everyone needs a master's of public health. Consider graduate certificates, short courses and certifications, experience-based pathways like fellowships and internships. For some, these options provide a better return on investment than a full MPH program. The conclusion here is, it's still worth it if you know how to use it. Despite challenges in governmental public health, the demand for skilled professionals remains strong. Public health education is a tool. Those who leverage it creatively will thrive. The public health job market is shifting, but those who adapt can find higher paying, impactful careers. Public health will always be needed, whether in policy, healthcare, corporate wellness, or technology. The bottom line is here, a public health degree is still worth it, but how you use it matters, now more than ever. Thanks for tuning in. Be sure to hit that subscribe button. Check out all the links below if you're interested in joining anything. And I will see you all next week. Peace, everyone. There's a problem with news and bias. Staying informed about public health and other health-related topics is harder than ever. Depending on where you get your news, you might not even hear about critical stories, or you might only get one side of the narrative. Take this recent case. A federal judge temporarily blocked plans that would have cut billions in research funding. But here's the catch. Right-leaning outlets might frame this as an attack on cost-cutting, while left-leaning outlets emphasize the dangers of slashing health research. Some media barely covers it at all. That's why I use GroundNews. GroundNews is an app and website that lets you see how different media outlets cover the same story, helping you cut through the bias and get the full picture of the issue. Compare coverage across thousands of news sources, see each outlet's political bias and reliability, discover who owns the media you're reading, and use the blind spot feature to find stories underreported by one side of the spectrum. I've been using GroundNews to track important public health stories and to avoid falling into one-sided narratives. It helps me to think critically about what's being exaggerated, sensationalized, or ignored. GroundNews is offering 40% off its Vantage plan. If you click the link below, you can go to GroundNews and get 40% off their Vantage plan, which is the one that I use. Your subscription not only keeps you informed, but it also supports making the media landscape more transparent. Check out news today and stay fully informed. Click the link in the bio below.